Srilata. She's got more than 20 years of experience and has had a number of awards and a lot of PubMed indexed publications to her credit. And with that, could we start your talk?
Yeah, thanks for that kind introduction, the chairpersons. And at the outset, I'd like to thank the organizing committee for this talk. And I know this is an offbeat topic. When they told me about this topic, like work-life balance and motherhood challenges, I thought, where do I fit into that? But yeah, as you go through the literature and your practical life, so this is how it has come up. First of all, greetings from Nizam's Institute of Medical Sciences. To start with, everyone must have recognized she is Dr. Anandibai Joshi. She is the first lady doctor of India. And the history is important in the sense, along with her, you can see other two lady doctors, one from Japan and the other one from Syria. Dr. Anandibai Joshi, after she is like very much supported by her husband. She came to that level because of her husband, the support of her husband. So it's a very good thing that we have to take home message also from this. And at the same point, the one who is from Japan, she completed her course and then she headed the gynecology department in Japan in one of great premier institutes. But she resigned at the age of, I think, 47 years or something. But why she resigned, it's a big query. Like, at that time, the reigning emperor of Japan visited that hospital and coming to know that the one who is leading the department is a lady, he refused to meet her. Now we can understand that may be one of the reasons why she has resigned from that post. Okay. The other lady from Syria, she, maybe because of her social problems or financial or family, she has not pursued her career further. So this is the history of our lady doctors, some doctors. And I think everyone must have recognized her. She is our first lady anesthesiologist of India. She is Rupabai Fardunji. She is from Hyderabad. She is also involved in the second chloroform commission. So coming to our topic per se, as the literature, like last 5 years, a lot of literature has come up. What are the challenges and anesthetists faces, women anesthetists faces, and the burnout, different literature regarding the burnout. Mainly, it is related to the general medicine, general physicians, and anesthetists. Most of the literature is pertaining to that. And we can see from the demographic that women are almost 30% of anesthesiology residents right now, around 25%, 25 to 30% of the overall anesthesiology workforce, and also 37% of the academic anesthesiology workforce. This is the recent clinics which has been published in 2022. This is the WFSA recent where the globally they have recognized the women anesthesiologist in 2023. And in this, we should be happy that 5 of Indian anesthetists were recognized. I'll come with the faces later. And coming to the Indian literature, recent literature, like 3-4 publications have come up and they have shown that, as we have seen now also, in coming MBBS courses also, like a lot of women or ladies are joining into the medical fraternity. And with the literature also, they have seen that as the first author in research publications and going to leadership positions in different institutes, and most of the, I think many of premier institutes are also right now headed by some lady anesthetist. So it's a positive thing for us. And I think many of us are groups of members of this group also. Here, around more than 482 participants are there in this lady anesthesiologist group of India. Whoever is not there, I think you can contact anyone who is a member, and you can be added over there. So right now it is 482. I think it must be double than that, actually. So we all know that to be successful in anesthesiology, it goes without saying that not only academically, but also we need to have that incredibly detail-oriented, skillful at all the procedures, calmful in stressful situations, and warm and caring to ease the patient's anxiety. So coming to the topic, what is work-life balance and challenges of motherhood? So what is the evidence? Again, these are the recent, I told, there's a recent clinics which have come up, and they have seen that the burnout from gender inequity from pandemic, they have, this is a publication which was published in the anesthesiology clinics in 2022, and there are a lot of review of literature, from the review of literature, they have shown that women anesthesiologists are the most likely to perceive and experience gender-based discrimination, mistreatment, and sexual harassment than men in anesthesiology. See, what we see, what we are talking in terms of like, I have talked to you and the other person has talked to. But when it comes to a survey and evidence and literature, still this continue, the gender-based discrimination, mistreatments, and harassments. So sometimes, like from the institute where I have come, we are maximum are women, and even the residents are women in our department. So many of us think, oh, no, it's changing right now. But still, we can see that the level of gender inequality still persists. So these are the unique challenges what we face, that is harassment, compensation inequity, decreased rates of promotion, I think many must have faced in their life, less representation in leadership. Though we reach to the HOD level, and right now it is like a rotational, so you have all the chances, but before, I don't know how many of us try to get into that post of through notification, try to go into that post of professor and HOD, we don't know. Then inequitable distribution of domestic duties, that's, it's there in Indian scenarios. Job insecurity and demand-supply gap, in the sense that now, even in anesthesia, we are getting a lot of infrastructure, good equipment, so we need to learn those things, and you take care of, we say as perioperative physician, so you need to go for the critical care management of these patients, post-op care. You want to go for pain management also. So there is a lot of demand-supply gap too. Okay, so that is another factor which is a challenge. And the fear of conception, it is mainly in the resident population. So if this is one of the factors which are shown in resident population, that many of them are not joining the anesthesia per se, anesthesia department per se, as residents. They are going, in one of the studies, they have shown that 10% of them, when they're counseled by the seniors, they say, okay, we don't want to join anesthesia, because if the fear of conception is there, then where do they go? Then finally, litigations. And again, though we know that our leaders, our women anesthesiologists are going to the leadership, to the higher level, but still, compared to men, it's a minority. These are some of those ladies which I have said in the previous slide. These are the women anesthesiologists. This is a recent WFSA, where WFSA has recognized globally some of the women anesthesiologists, and these 5 are Indians. At the same time, what are the challenges of motherhood and as a wife, you know? Women very often have to interrupt their careers to accommodate their spouse's careers and to manage issues like pregnancy and child upbringing. I think this is, everyone must have gone through this phase. I don't know, if 1 or 2 are there, they are very lucky enough. And many women do not get the family support, hence have given up the golden opportunities in their careers. So these 2 are most of the common things which are faced by a married lady. And leave opportunities. We know the The period leave, nowadays we talk about it, but how many places it has been granted or it's already in use, we don't know. NMC has not taken up that. And I think in Infosys and some companies, they've started like 6 days in a year, it can be given to those ladies. That's good. And the other one is maternity leave. Maternity leave, in our institute, it is like 120 days. In government, I think in the central government is the best thing they have done. It is 2 years from the birth of the child till 2 years. A total of 2 years they can take for that child till the child is 18 years of age. Any time for the education or for the maternity. So total of 2 years. That's the best thing which the central government has done, and we should be happy for that. So this is known as, what do you mean by burnout? So burnout means it is characterized by emotional exhaustion, depersonalization, and a sense of low professional accomplishments. This is again, has been in WHO in 2020 has declared stress in the workplace a worldwide health epidemic of the 21st century. Okay, and I think Dr. Nagarjun is going to deal with the coping challenges, whatever is there. So my topic will be restricted to work-life balance. And this is again important. The most frequently identified sources of mistreatment is again, this is also in the surveys what they have encountered. There's the patients and nurses, followed with the surgeons and other anesthesiologists. That is work, and beyond workplace, what all we do. So again, we know we have our homework, the daily needs of the home, we need to look after, like whatever, chawal, dal, vegetables, whatever you name. You are the person who deals with that. And as a mother, you want that your children eat good, tasty, healthy food. So you will be after them. As a daughter-in-law, you need to take care of your in-laws. And also dealing with the most valuable persons. Can you name those most valuable persons? Your maids. I think without them, we don't live. Your maids, daily care, the milkman, the newspaper man, whoever comes, those are the most valuable persons of our day-to-day life. So we need to give time to them. We need to deal with them, then only we can come to the workplace. But we should not forget where is your personal time. So that is where the question comes. I know, like, every one of us has only 24 hours in your hand. Yours 24 hours, mine is also 24 hours. So how do we deal with it? So in that 24 hours, everyone speaks like that 8 hours sleep is the most important thing. So you can't deny that 8 hours. So 8 hours is gone. And whatever work we do, minimum of 8 hours in whatever corporate or government, wherever you work, the minimum of 8 hours you need to. So that is 8 hours. So rest is what? Travel, you do whatever in between, going to the hospital, coming back, and what else you do? It is like the time is not allotted at all. What we call is life. Okay. Sleep, I don't want to go further because we need, the coping strategies in here is going to say early to bed, then only you can do management of your time. And when you're in stress, obviously you won't have a good sleep. So that vicious cycle is very painful. Okay? But we should not forget the mantra of life. If you want to have a work-life balance, this is the most important thing. If you try to please each and everyone, you'll please no one. It is impossible to lead your life for others' happiness. Yeah, your others' happiness is important, but first and foremost is your happiness. Your happiness, it should be connected to others' happiness. That is the most important. And this is very important. Sometimes saying no is not bad. We should always think about it. Going for lecturers, going for conferences, to whatever level you can go, but at what level you have to limit yourself, you're the person who has to decide. So doing what you like is freedom, liking what you do is happiness. So you should have your personal priorities in our life. What is the style of working? How do you work at your place is your style. How do you manage your time? Ability to fit in outside interest, recreations, and the most important, spouses need us is not forget. That is the maintenance of our life, availability of social life, religious needs, and the other important thing is quality of schools for children. Obviously, we are working for our children. So the quality of schools, again, it all depends. It's a vicious cycle for us. I've said best friend dynamics we should never forget. We should always carry your husband along with you. Nurture your relationships. Don't worry when you're not there as much you might like. You may not give the maximum time. Daily, you may not be able to give this 2 hours, 3 hours to your family time. But whatever you try to give the time, you should be there. You should be present when you're there. Okay? That is what is important. Don't worry when you're not there as much you might like. Just be present when you are. And this is again important. Carve out time to exercise. Nowadays, I think post-COVID, everyone has started this, but still we need to stress on that factor also. This is a very, very important factor. Connect with nature and carve out time for exercise. I think Facebook and WhatsApp has done the things easy. You connect with your friends, you have your get-togethers. Everyone must have their get-togethers. You should continue doing that. And expand your interests. Look for opportunities to give back within the specialty or your community. So like workshops, whatever you're good in, try to do the workshops and try to give the same thing to your juniors. And do charity wherever possible. Try to create hobbies as far as possible. Music, singing, dance, any mental mathematics or any board games, you should just continue with that. Don't try to do everything. Hire services if you're not a veteran in that. And this is, again, I just wanted to focus on, this is a recent a lady doctor, she expired. I think many of them must have gone through that WhatsApp news. She couldn't had a health checkup for her. She had headache 3 days back, but she couldn't go further with the health checkup, landed in a stroke, and she died. So, and this is again another, this is a patient of ours. You can see the whole, half of the brain is gone with meds. So live your life wherever possible. Don't hesitate. Take your time. Live your life. Go for vacations, at least 2 to 3 with your family and friends. Workplace, I think the dynamics of workplace, Dr. Nagarjun is going to deal with. And always set your own skills. And if you have time and a good teamwork, I don't know how many of you work in corporate and whether you can have a teamwork or not. What we do as a team, like after 4:30 or something, 3 of our faculty are there. We try to divide ourselves. So one faculty stays back after 4:30, unless until it's a very not a complicated case. So at least 1 or 2 faculty are free to go home and take care of their family and friends. Update yourself. Soft skills has become a curriculum of NMC. So this is again an important part. I'm not going into that. Think beyond pay. Always don't go after pay. That is not the life. Investment, obviously your husband does it, but also you should have some interest in doing that. Learn from people who know, and reevaluate yourself every time. Always try to, when you sit back alone, also try to introspect yourself, what you are doing, what is best for you, what is best for your work. Sorry, I can't continue, but this is a very nice article. If you can go through this, please go through this article. This is one of our Nepali doctors. She has written how she has compared our, can I complete this slide? Yeah. This slide, she has compared our anesthesia profession to motherhood. Like safety, safety, safety. The first thing what we do as a preoperatively, we check the patient. The similar thing when you're going through the pregnancy, you go for health checkups, you try to plan how the baby is going to come. Similarly, what we do in anesthesia, safety checklist we follow, and then we try to plan our anesthesia. That is the first step. Second is a sound sleep. You want your baby to sleep. Similarly, we want our patients to have a sound sleep, going through all the phases of depth of anesthesia with good relaxation. So that is the second step. What is the secret ingredient? Here is the breast milk, and there, most of the, nowadays we use propofol. So that is how she has compared it. And very nicely, like even for small complications also, if there is a patient has a laryngospasm, we try to give some small doses of propofol. So that's how she has compared that even with baby has some small qualms, you give some breast milk and then to pacify the baby. Vigilance, that's the vigilance. Like whenever the baby is playing, whatever, doing something, going outside, we always have our eyes on that side. So the same thing, vigilance. And the helping hand. Without helping hand, even at home, at work, we can't continuously work. We always need a helping hand. Battle gear, whenever you take the baby out, you always take the diapers along with the toys, the extra clothes, same thing. Battle gear, we have got a difficult card, defibrillator, everything we take in hand. Always cool and easy with the kids, the same thing. You need to be, in difficult situations, you need to be very cool. And the last one is very important. You don't expect anything from the patient after the surgery. Also, you know that you don't get any gratifying results or whatever. No one is going to appreciate you. So similarly, the same thing with the baby also. Because we have that love for the baby, we do it. We don't expect anything. Similarly for the anesthetist. So this is the end slide. Vision without action is merely a dream. Action without vision is merely passing time. Vision and action together can change the world. This is also Sudhamurthy's very nice video. If you have time, please go through that. It's a nice video. I don't know, audio is not coming. But if you have time, please go through that. The way she has described a woman like a double strength than a man. We know him that he is successful, but equally how she has supported him, that is hats off to her. And that's how, this is how the work-life balance we need to have in our profession and in our personal life. Hope you all enjoyed. Thank you.